All right, so I'm the research project coordinator for a project called Benchmarking Food Environments, and that's out of the School of Public Health at the University of Alberta. And this project is co-led by Drs. Kim Rain, Candace Nikiforuk, and Katerina Maximova. And I just want to kind of go over some background first before I get into it. The World Cancer Research Fund Continuous Update project analyzes global research on how diet, weight, and physical activity affect cancer risk. And in the same way that strong research linked smoking cigarettes to lung cancer, which prompted tobacco control initiatives, there's strong evidence that overweight and obesity increase the risk of 10 cancers, while the consumption of non-starchy vegetables and fruit decreased the risk of several cancers. Tobacco control initiatives were successful due to benchmarking and publicizing government initiatives through performance indices. Tobacco control initiatives, similarly, this project, Benchmarking Food Environments, through our nutrition report card, gauges policy related to healthy eating with hopes to also generate stronger government policies and actions. The concept of benchmarking applied to food and nutrition policy is gaining momentum internationally. One group called Informas, which is an acronym I won't go through what all that stands for, has outlined a nourishing framework to monitor benchmarks relevant to food environments, which we used in creating this nutrition report card. And so that's what I'll go over in more detail now. So if we know that healthy eating prevents chronic disease, what do we do? Well, the principal investigators of this research project, along with a group of nutrition experts across Canada, created a nutrition report card inspired by the Participaction Physical Activity Report Card. And that report card was, is, an annual assessment of how Canada is nationally promoting and facilitating physical activity opportunities for children and youth. And it's graded by an expert committee, and that serves as a tool for knowledge translation, building awareness, informing policy, and guiding practitioners. So this inspired us, and in the same way that we have an expert committee grading our indicators. So far we have 2 nutrition report cards that have been produced, 2015 and 2016, and since then we've received funding from Alberta Innovates to continue this annual report card for the next 5 years. This report card is really an assessment of food environments and nutrition policies that support or create barriers for improving children's eating behaviors and body weights. So when I say food environments and nutrition policies, what we're talking about is about 5 environments that encompass and impact children's eating behaviors. The first is the physical environment, and that is what is available in a variety of food outlets, including restaurants, grocery stores, school cafeterias, work sites, community sports, and arts venues. The second environment is the communication environment, and that's related to food-related messages that influence children's eating behavior, and that includes food marketing, as well as availability of point-of-purchase information in food retail settings, such as nutrition labels and nutrition education that they receive in school. The third is the economic environment, and that refers to financial influences such as manufacturing, distribution, and retailing, which primarily relates to the costs of food. And these costs are often determined by market forces. However, public health interventions such as monetary incentives and disincentives in the forms of taxes, pricing policies, and subsidies, financial support for health promotion programs, and healthy food purchasing policies and practices can also affect food choices. And the fourth environment is social, and that refers to the attitudes, beliefs, and values of community and society. And it refers to the culture, ethos, or the climate of a setting. And this environment includes social responsibility, the health-promoting behaviors of role models, values placed on nutrition in organizations, and relationships between members of a shared setting. Encompassing these 4 is like a macro environment, and that's the political environment, and it refers to a broader context which can provide supportive infrastructure for policies and actions within these micro environments. And that conceptual model was adapted from Brennan and colleagues. So inside that nutrition report card, this is one of the pages that I'm showing as an example, we have 31 indicators, and these are in key areas in each of those environments I talked about. And the indicators must relate to policies or actions with potential to influence the eating behaviors that children have or their body weights. It must be policy relevant, amenable to government influence, and it must be feasible, a target for data collection that can be quantified and repeated across settings. It also must be supported by evidence of effectiveness and population impact. And last, it must highlight opportunities for intervention and change. Along with the indicators, the second is the benchmark. And these are really goals that we're aiming for that can be taken for each indicator. And they may help to improve children's eating behaviors if they're met. And benchmarks are not intended to fully measure each aspect of the indicator, but they rather are to provide a standard to, as a goal to meet. So I wanted to start out with the successes of Alberta, and in our nutrition report card, there are 2 A's that Alberta has met in the benchmarks. One is with the healthy foods being exempt from point of sales tax, and that is achieved through the Government of Canada's excise tax, which provides information on what foods are subject to or exempt from point of purchase sales tax. Second, the second A is there is an evidence-based food rating system and dietary guidelines for food served to children and tools to support their application. And that was developed and released in 2008, and that is the Alberta Nutrition Guidelines for Children and Youth. And these guidelines and their implementation are kind of what leads to some of our other benchmarks and the lack of those guidelines being implemented or just not being mandatory. So we do have some failing grades, which it's hard to talk sometimes about the negative, but what this does though is it helps us to focus in on these areas of need. So within the physical environment, having high availability of healthy foods in rec centers is one example where we didn't meet the benchmark of 3/4 of food available in rec centers being healthy. So an action to move in a positive direction there is to mandate and provide incentives for implementing the Alberta Nutrition Guidelines for Children and Youth that I mentioned as a way forward. In our communication environment related to the messages that children receive, one of our indicators is restrictions on marketing of unhealthy foods to children, and our benchmark would be that all forms of marketing unhealthy food to children are prohibited. Again, we didn't meet the mark there, but an action would be to develop a national regulatory system prohibiting commercial marketing of foods and beverages to children. Within the economic environment, one of our indicators that wasn't met was the affordable prices for healthy foods in rural, remote, or northern areas. And the benchmark for that would be that there would be subsidies available for transportation and local production of healthy food to rural, remote, or northern communities to ensure affordability for local consumers. So an action towards something positive there would be to expand the Nutrition North program to include more remote communities and provide subsidies for transportation and local production of healthy foods in these places. And within our social environment, one of our indicators there would be for weight bias being avoided. And the benchmark is that weight bias is explicitly addressed in schools and childcare settings. An action towards movement in that area would be to develop and implement provincial policy prohibiting weight bias in schools and childcare, which addresses weight-related teasing in their anti-bullying curriculum that they already do. And our final environment is the macro environment and the political environment. And our indicator there would be that child health promotion activities are adequately funded. The benchmark is at least 1% of the health budget is dedicated to the implementation of the government's Healthy Living and Obesity Strategy Action Plan, with a significant portion focused on children. And again, that wasn't met, but we would, to work towards that, want to kind of make changes towards increasing that budget and also making it more transparent where those health dollars are going. So I'll just wrap up. I just put this picture of the ship on because I thought, this report card, the nutrition report card, really charts a course for where we can go. It provides benchmarking to indicate goals that are really achievable. There's international support and people looking at these same kind of benchmarks across the world. And we have kind of tailored them to our local context in Alberta, but these are a way forward, looking at these benchmarks, and it really is a call to action. The benchmarking helps to strengthen the accountability of systems relevant to food environments, with the overall goal to stimulate a greater effort from governments to reduce obesity, non-communicable diseases, and their related inequalities. And I'll just put a plug in here for our research. We're looking to connect with other people that would like to continue this discussion about benchmarks, and we'd like to continually improve our nutrition report card over the next 5 years to be a tool for people to utilize to move towards these benchmarks. Thank you.